Perfect. Very
Okay,
clear.
great.
Awesome.
Awesome. Yeah,
How's it going, Minhas?
it's going well, except I do apologize. We're having some pressure washing done today. I didn't know that was going to happen, so I apologize about that. So if there's some background music or sounds, apologize.
No, that's completely
No
fine.
worries.
So thank you for taking the time out of your day
Yeah.
um to just have a conversation with us. You know, we're students.
Sure.
We just want to learn a little bit about what life is like as a healthcare professional.
Oh, what
Um,
is life like as a healthcare professional? Wow. Okay. What other questions do you have?
just let's start off with like an introduction of who you are, what you do,
Yeah.
where you
What
work.
specialty?
Yeah, absolutely. I'm a family nurse practitioner. I work in functional medicine and anti-aging. I also do primary care. So it's kind of an integrative approach. I work at Katy Wellness Center, and we're one of the best functional medicine clinics in Katy. But definitely, we try to find an approach on how to prevent disease in advance. I'll give you an example. So, not a lot of people know that there's a lot of polymorphisms out there, like something called MTHFR. And what this does is it prevents you from methylation. It's basically a methylation defect. So I'll give you an example. So when we eat meat, right? It gets broken. It's a protein. It gets broken down into amino acids, and eventually it turns into something called homocysteine. Now, homocysteine, if it builds up and builds up and builds up, it can be very detrimental to your cardiovascular health and your neurological health. And this is just anecdotal, but what I found is people who have high homocysteine also tend to have hormonal problems, hypogonadism. Even women have hormonal problems.
Hmm.
So again, this is just anecdotal. I just see this correlation. I don't know if it's causation or correlation. Um, but when this homocysteine builds up, you are at risk for cardiovascular disease in some instances. And a lot of people will die prematurely because they've never had this tested by their physician. I don't know how many physicians actually test for this. I know a lot of them do test for it, but I don't know if they know how to actually treat it. And it's actually a very simple treatment. So if you have a high homocysteine, what I usually do is I check a vitamin B12 and a folate. And if their folate is high, B12 is kind of low, homocysteine is high normal. Anything over 6 to me is kind of suspicious. I think the reference range on Quest Diagnostics is like 10.4, but if you're already there, it's pretty bad. So that's kind of the poor man's way of testing it. And what you do, you just give them something called methylated folate. It's not very expensive. It's very inexpensive, maybe like $20, gives you like a 4-month supply. And this allows you to have a methylated form of a methylfolate. And that's what that's going to do. It's going to allow you to break down that homocysteine into cysteine. And this is what we want. We don't want that buildup of homocysteine. So this little thing right here can, in some cases, prevent a cardiovascular event, 20, 30 years down the line. And it can actually add, if not that much, maybe more years to your life, quality and quantity. So that's one of the things that we do that's not so complex. I think actually a lot of primary care providers can do it. It's just that do they go out and get that extra education? Too many of us, we get in our careers and we're just like, wait, we don't need to learn anymore. If your healthcare provider's in that kind of a zone where he or she is content, then you need to finally probably find another healthcare provider, one who's more passionate about what they do, and one who's consistently growing and learning. So yeah, that's one of the things I do.
That's actually pretty cool because, at least me, what I understand is that a lot of doctors, a lot of healthcare professionals, they do what they're told. You know, they have to follow a very strict procedure. But essentially, what you're telling me, you said the Katy Wellness Clinic, you guys are kind of going out of your way to expanding on that healthcare spectrum to be able to do more tests to improve the quality of life for people. So that's really interesting. That's definitely
Yeah,
really interesting.
absolutely.
Right. And
So
right now I'm working, oh, sorry, medical assisting at a primary care physician. And she's never like, I mean, she does the routine stuff, but I've never heard her talk about, homocysteine or folate or anything like that. So yeah, it's really cool that you look into those things and, you're more specific with your patients.
yeah, and there's so for us it's anti-aging, right? So that doesn't necessarily mean like, hey, looking good. Just for the record, I am 96 years old. Uh, no, I'm not. Um, No, we do specialize in anti-aging, but that doesn't necessarily mean like, we're going to make you just look younger. I mean, we have an aesthetics department. We do all that as well, but it's about, okay, so if you look at centennials in the blue zones, all right, if you ask them, if you survey them, and you also do some objective lab data and you get a health history, there's not a lot of commonalities, and there's some, but mostly there's things that strike differently. Their diet may be different, the water supply is different, the atmosphere is different, the temperature may be different, the cultures are definitely different. But one thing in common they have is how they handle stress and how they manage stress. So this kind of brings me to the forefront of, I think, longevity in my perspective is stress management. And first of all, you kind of need to identify that you even have stress. Some people are just fatigued and they don't know why they're fatigued. They're like, oh man, I'm just tired all the time. And you tell them, hey, maybe you're stressed out. And they say, no, I can't be stressed out because I'm tired. If I was stressed, I would I would be like more hyper. Well, if you have high cortisol, you can be fatigued. If you have a low cortisol, you can be fatigued. And so the one thing that they all have in common, these blue zones where people live to be 100 years average life expectancy, is they manage stress so well. They don't let things get to them for a long term. So another thing we do here is we do saliva testing, which is the gold standard for cortisol. And the reason we do saliva versus serum is when you get poked with a venipuncture, it spikes your cortisol. So you can get a 30 to 70% skewed result, right? And that makes sense. Particularly me, myself, I get a little nervous before I go get a blood draw. So I know my cortisol is probably going to spike and it's going to be skewed. But what we do is we do the saliva testing. And saliva testing is basically you get a kit at home. And we use a particular company. I'm not going to mention them today. No free promos. But yeah, you get either something called a cortisol awakening response, which is a 6-point cortisol test. Basically, you spit in a tube 6 times throughout the day. We catch the first hour and a half, and then we catch one at noon and at 6 p.m. and right before bed. So we get a nice little curve to see where your pattern is. And the other one is called the diurnal cortisol test. And that one just looks at 4-point cortisol awakening, and then at noon, then at 6, and then at 9, or whenever your bedtime is. What we can find here is if you have a nice healthy curve where like it starts off a little high and then it starts tapering down as you get throughout your day. The reason this is important is cortisol is actually very catabolic, specifically to the brain. So it's not anabolic. It breaks tissue down. It does not build it up. And that's very important because the hippocampus, which is kind of like the circuit breaker for your adrenal glands, is if that thing is doused in cortisol, it's going to inflame because it's catabolic, right? So if you have an inflamed hippocampus, what happens is you're going to be, this is usually when people are in a high stress chronic situation. They have like a stressful job. Let's say they have a stressful boss, finances aren't in order, their home life isn't in order, bills are piling up, or they're just anxious people. And then on top of that, they have these, outside problems coming in as well. So this is like long-term chronic stress. So cortisol is going to keep going up, 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 up. They're going to be wired and tired sometimes in bed. They can be tired throughout the day. They don't know what's going on. They think it's maybe it's their testosterone, maybe it's their estradiol. They don't know what's going on. But what's going on is their brain is essentially on fire. And the brain is on fire because that cortisol is very catabolic. And it's basically just melting that brain. It's being bathed in cortisol. And so when this happens, just like whenever you get an infection where you get, or you get hurt, you get some inflammation, you have an immune response. And an immune response in the brain is called microglial cells. It's basically the same thing as immune cells. They have 2 phenotypes. They have an M1 and an M2. So one of these phenotypes is more rest, repair, recovery, lays down collagen, helps soothe and cool the brain down. And that's how it's recruited as. Okay. However, in the presence of more cortisol, this microglial cell, it transitions into a thug. It transitions into cytokines, and more inflammation, and so you get this, unintended response of more inflammation. And so now the brain is really on fire, right? The brain's just like, oh my God. And this happens for a prolonged period of time. And now let's say you have like a death in the family, knock on wood, God forbid, right? Or you lose your job or something really stressful happens. You lose your spouse or something, right? And that can just take you over the top. And now what happens is when you're in a high cortisol state for so long, you're actually immunocompromised because cortisol is kind of like prednisone. If you guys are familiar with prednisone, this is what we give people if they get like a bee sting or if they're having like a COPD exacerbation or if they have a really bad cough and it's just not going down. We kind of suppress your immune system with prednisone. And so cortisol essentially is prednisone, okay? And so it's suppressing your immune system. So you have a suppressed immune system. So this is called Th2 dominance, right? So at this point, when you're high stressed, high cortisol, you have a suppressed immune system, you may find things like dyspepsia, like heartburn. You may find like some eczema and some allergies, food allergies. But you're not going to have anything else really. Some fatigue, definitely. Now, when you have that very stressful moment, or it's just been going on for too long, something that kind of breaks the camel's back, the straw that breaks the camel's back, then what happens is that the HPA axis, the circuit breaker for that is the hippocampus. And the hippocampus will say no more. The brain's on fire. We have to preserve the brain against all else, right? So it'll downregulate cortisol. Say your cortisol is up here. It's supposed to be down here in the middle. It'll downregulate it down here. So now you have a very low cortisol. And remember, I discussed earlier that the immune system is suppressed. It's kind of shackled. Well, now it's unleashed because cortisol also modulates the immune system. When this happens, this is when you're going to find, if you ever talk to any of your patients who have lupus, in some cases rheumatoid arthritis, Crohn's disease, Hashimoto thyroiditis, if you ask them when were they diagnosed, if they have a good diagnosis date, or even a year, and if you ask them, hey, did you have a stressful, very stressful event around that time? And 9 out of 10 times you're going to find that they're going to say, yeah, you know what, something really stressful happened, right? And that's what actually kind of triggered it, right? And this is not really in theory. Some of this sounds theoretical, but this is objectively, verified data. This is, you can see this on an MRI scan, an fMRI scan, the brain being catabolized. And it's shrinking. The hippocampus is shrinking. The prefrontal cortex is shrinking. The amygdala, although it is also sensitive to cortisol, it has an opposite response. It actually grows and enlarges. So what you have here is you have poor executive decision making from your prefrontal cortex being hindered and shrunken and damaged. You have an overzealous emotional response because your amygdala is enlarged, and that's kind of your emotional response system. And you have poor memory recall. So doesn't this sound like a lovely patient? Like,
oh my God.
Right? And so we really need to find out if you have high cortisol at an early state. If you're stressed out, it's good to come in and get your test done because we have natural remedies. Of course, we definitely use like massage therapy. We use stress management techniques like just talking to somebody, meditation, mindfulness training with lessons about gratitude and other things along that line. But we also use adaptogens. We use something like ashwagandha, we use rhodiola, magnolia, philodendron, L-theanine. These are all natural supplements that we use, and they're very inexpensive, and you can generally get those anywhere online. Now, I'm not going out and recommending anybody go and try this without speaking to somebody who knows what they're doing. So talk to your healthcare provider, your primary care provider, or your functional medicine provider. Don't go out there and just go buy something randomly right now. This is not medical advice. None of this is medical advice. This is just for discussion. All right.
No, of course.
Yeah. So, I've been able to really impact people's lives very, very positively, and where they're more productive, they have better family lives, and we can objectively see their cortisol levels coming down. Now, somebody who has, I don't know, Zain, if you can pull something up, if you just kind of look up diurnal cortisol.
Diurnal cortisol? Yeah, I can
let's look at a curve, and I'll show you a couple of different pictures on there. So there's a good healthy curve, and then there's a flattened curve. And the flattened curve is where your cortisol is low throughout the day. And that's very dangerous. What that does is that really means that your brain basically has been fried. And And there's two kinds of ways. There's two types of brain frying. There's one that's unfortunately permanent, but then there's one that is not permanent. Okay, so one is called dendritic retraction. So these are the dendrites. These are like the branches of neurons in your brain. They're beautiful branch-like features in your brain, and when they're under high stress and high cortisol, they basically retract. And again, that's called dendritic retraction. And it looks the same on MRI as a brain that's been completely fried. We really cannot tell the difference. The only way we can tell the difference is by treating you. And if we treat you with certain remedies, after about a year, if we repeat that MRI, assuming you're also feeling better and doing better, that there's this notion that the brain can heal, and you do see these dendrites actually blossoming again. And it's a beautiful thing when you actually see that, because you know you've actually saved someone's brain, and you save someone's life essentially, right? So there are certain things out there that I use. I use something called a Synapsin nasal spray, and it's a fantastic spray. You get it at a compounding pharmacy. It has RG2 and nicotinamide riboside, which is like NAD, and then we usually mix it with a little bit of B12, or we use a low dose naltrexone. And this comes from an Asian ginseng, and it has brain healing properties, and then the NAD has kind of like brain food properties. The low dose naltrexone, I use that for anybody who has any autoimmune. It's all in the nasal spray. It has anti-inflammatory properties. This is not the same naltrexone you get in a full dose. This is a very micro dosed.
Okay.
Yeah, and this is a very awesome nasal spray. Anybody who's had like a brain injury, traumatic brain injury, or concussions of any kind, or even dementia. My dementia patients use it. Alzheimer's patients use it. Anybody who's a professional fighter or a football player who's had to taken some hits to the dome, they should all use it. Anybody who's having any memory problems, maybe not anybody, but in most cases, I put them on this. It's a nasal spray. It stays in your fridge. 2 sprays, 1 in each nostril, twice a day. Compliance is kind of an issue sometimes because, you know, it is twice a day and it's refrigerated. But after about 3 weeks, you start seeing some benefits. You certainly do. And I usually put people on that for 3 months on and 3 weeks off. And yeah, we've seen some great long-term results. We also see good short-term results. So again, this is something that that I don't think a lot of physicians out there are doing right now. And that's kind of what separates us from the rest of the pack. We do a lot of gut health. We do bioidentical hormone replacement therapy, whether it's topicals, injectables for men, and then pellets is something I also specialize in as well.
Okay. I think earlier you mentioned stress management. So as students, I'm sure you can understand that. We're stressed. We're stressed, right? We have exams, we have finals, we have work, school, family life to deal with. So I mean, you were a student at one point. How did you cope with stress, and what would be some of your advice for students today?
Yeah. So first, I would really like you guys to understand what I just said right now, because you may not know that stress is actually frying your brain, and you're not going to do very well in life with a fried brain. You need all your neurons, you need all your brain cells. So if you can kind of like wrap your head around this, not only will you be a better student, but you're going to be a better provider. You're going to be a better father, a better husband, just a better friend, because you truly can visualize what I just mentioned right now, right? So that's the most important thing. It's kind of like, when you tell a child, hey, brush your teeth or you're going to get cavities. Most children don't care what a cavity is. They don't know what cavity is. Most adults don't know what cavity is, right? But if you show them a YouTube video on what's happening, and like, this is what's going to happen, the enamel's broken down and it gets out to the root, and these little bugs, these microbes are actually digging and producing acid and melting your teeth, and eventually you're going to have a root canal, and that root canal can also cause heart problems in the future. And if you really educate somebody, especially somebody who's in the realm of education and learning, and specifically medicine, then if you ask that child that, yeah, you can have this candy, but you got to brush your teeth afterwards, they're going to be like, you know what, I don't think I want that candy, and because I brush my teeth later. But if they do have the candy, they are going to brush their teeth later, right? So this is kind of the same notion that if you have a medical student, right, or any student who's stressed out, law students, any student, right, all everything's relative, right? All the stress uh, in our academic lives is very, very relative to what we're learning. So if you understand what stress is doing to you, you're going to have a better idea of how to manage it, right? So then you can do those techniques. Like I have this app I really like. It's called Waking Up by Sam Harris. And Sam's great. If you send him a message and you're a student and you let him know, hey, I'm a student, I can't afford this right now, he'll give you 6 months scholarship for free or give you discounted plans. He has all these lessons in there. These lessons are fantastic. Gratitude, mindful, all of it's mindfulness. The last time you did something, or begin again, for example. These are just little subtopics of his lessons, and they're 2 minutes, 3 minutes, 4 minutes. And I listen to these every night. I usually sit on my massage chair and last 30 minutes of my night, and I kind of just go through these. And I've heard them like countless times, but every time I hear it, it reinforces it. And it's great. It really is, and it really works. So apps like that, we have those resources right now. I think it's important to use those. But above all else, you really have to understand that stress is catabolic. And if you want to live a really long, healthy life and you want to have a full brain with all your power in it still, then you really need to, manage that stress and understand what it's doing to you in real time, right? In real time, you get a stressful situation, you're going to say, hey, you know what? Somebody cuts you off in traffic. I'm not going to, you got to understand, you got to tell yourself, hey, maybe you got to lie to yourself sometimes. You got to say, hey, maybe his wife is pregnant in the back seat and he's going to the hospital, right?
Yeah.
And then it's okay, right?
Definitely have to work on that one.
Yeah.
Yeah, absolutely. And if you see drivers out there, most people we talk about, I'll give you an example, right? There's a lot of misinformation out there. I have patients come to me after a few months. I put in my metformin, for example, because they really needed it, right? We use a integrative approach, so we don't always put people on pharmaceuticals, but in some cases we do. They'll come back, and I'm like, okay, I'll look at their A1C, and this is basically the average of blood sugar that their red blood cells have absorbed in the last 3 months, and this kind of lets me know if they're diabetic, pre-diabetic, or none of the above. And they come in, borderline diabetic, like 6.5 A1C, which is diabetes officially. Put them on metformin, they come back 3 months later, I get their labs, and it's like 7.0. I'm like, what happened? The metformin didn't work? No, my my sister sent me this link about how metformin causes cancer, and I don't want to get cancer. And I say, that this is a good example of when you're driving down the freeway and you see a traffic jam. And when you approach the point of where it's jamming up, you see a car on fire. And everyone's, stopping and looking like, oh my God, this car's on fire. But you never see that when there's a beautiful full moon or a beautiful sunset. Nobody's paused this for that, right? My point is that sometimes the media and social media, the clickbait sites, they put stuff out there that's gonna cause you to look at the death and destruction, because our brains are wired for that. We're looking for that. We're intrigued by it. But nobody's intrigued by metformin. Technically can prevent cancers in the colon. In some cases, it's anti-aging. It can, save your life. People on metformin who are diabetic with controlled diabetes live longer than non-diabetics who are not on metformin. So nobody looks at those studies because they're not appealing. They're not clickbait, right? They're not clickbait worthy. But hey, metformin causes cancer. Oh my God, my sister uses metformin. I better let her know. I'll share this article. And then, it's not written by a doctor or anybody. It's not a real study. And so people like to stress themselves out a lot, right? We do this innately. It's like we're programmed for it. But I would like to just remind everybody, be cautious of that. Be wary of that. I honestly, I'm not giving this as my bit of advice, but I try to avoid all negativity as much as possible. I don't necessarily put myself in a full bubble. I look outside that bubble every once in a while, but I'm not going to keep looking at CNN stories about, just horrible, atrocities, because that's going to keep dampening you, making you weaker. And it's going to make your stress response, your triggers are going to be a lot easier, right? The threshold goes down for being stressed out because you're constantly being doused with negativity. So I would say, always have a positive mindset, avoid the media and the fear, uncertainty, and doubt. Do your best to be positive and optimistic. Always try to be the most optimistic and the most positive person in the room. It's a really good it's really good advice for success, not only just to be a good coworker, a good family member, excuse me, but just for your own sake and your own health.
Definitely. Like I look at it like this, where a lot of people nowadays really like, taking that pessimistic approach to life. They want to see the negative in everything. And that's a lot of students too, hey, this exam's coming up, we got to study or we'll fail. It's never we got to study so we can pass, or so we can do
Yeah.
good. It's never like that.
So we can learn. Yeah.
And for students who are stressed, because I was one of those that, so I used an exam to get really amped up. And I liked it because when you go in there prepared, it's like, all right, I'm ready for this. But there were some instances where I went in there, I was like, oh my God, I'm gonna ace this. And I got like a C. I'm like, what the heck happened? And that can happen sometimes. It's true, it can happen. But I went back and I said, you know what? I probably didn't study enough. There were some factors that definitely played into it. I didn't want to blame the teacher for it. But I found out that I was really high strung during these exams, like really high strung. And I think it was kind of like blocking my brain in some aspects. So what I looked into is something called L-theanine. It's a natural anxiolytic. And a lot of my students right now who are my patients, I give this to them. I tell them to take this maybe about an hour or 30 minutes before an exam. Of course, try it before the exam, maybe the day before or 2 days before, see how you respond to it, and make sure there's no adverse side effects like dyspepsia or something of that nature, right? But basically, it comes from a green tea extract, and it has this calming effect. It's not like a benzodiazepine, like a Xanax, where it's going to just knock you on your butt. It actually makes you more focused, but it allows you to kind of get your thoughts in order. And what I found is when I took this, my palms weren't sweaty anymore. I wasn't so on edge. In fact, I would actually have to listen to like some really like I would listen to Rocky before the Eye of the Tiger, right? Before I go into my test 5 minutes before. I had to kind of amp myself back up a little bit. Versus having to like deep breathe before a test. So and what I found anecdotally for myself and the students who come back and tell me, hey, they're acing their exams now and they're finishing in record times. They're not second guessing themselves, and it's really helped them even when they're studying for the exam, because sometimes when you're studying for exam and you understand the stakes are really high, it may hinder your ability to actually learn, because you're just stressed. Again, it's catabolic to your brain, right? Going back to that notion of the brain on fire, right? If your brain's on fire, it's going to be hard to retain some of the information that you're learning, right?
Definitely.
Yeah.
Right. And then I know not everyone is so familiar with, the educational path to become a nurse practitioner. So, kind of, where did you go to school? Where did you do your master's?
Yeah, absolutely. So I first out of high school, I went to the Marine Corps. I went to the infantry. And that was in 2001, July. And of course, September 11th happened a couple months later while I was in boot camp. So that kind of, wow, that really sucked, of course. So after the Marine Corps, I came back, and so my family was all in business. And so I thought, hey, I'll try the business realm. And I did it for a while, and I had some ups and downs, some successes and some failures. I probably wasn't fully prepared for what I was getting myself into, right? I kind of blamed just the stars, said maybe it wasn't my luck, but I didn't really like realize, hey, I didn't have the education and I didn't put the time in, and I was kind of over my league, right? And so I started back from square one, and I was having a conversation with one of my cousins, and I was like, hey, what are you doing? Because I went and got a business degree as well, but I didn't like it. I didn't like I didn't like the business world at this point. I was kind of jaded. I saw a lot of fraud, and I saw like nothing egregious, but I saw just how it's just about making money, and I felt like so if you want to do what I do, you have to have the right intentions. Otherwise, don't do it for the money, because you're going to hate your job. You're going to be very poor at it. And hence you're not going to make a lot of money in this field if you're not, if you don't love what you do and you're not passionate about it. So what I found was that I wanted to help people. And even in the business I was in, I was always constantly helping people, giving them advice that was kind of counterproductive to the business model itself. So at that point, I talked to my cousin. He says he's going to be a nurse, and I was like, a male nurse, really? He's kind of a masculine guy. He's much bigger than me, and he's like, yeah, he's like, it's not the end goal. I want to become a nurse practitioner, and I've never heard that term before, nurse practitioner. I was like, so what's a nurse practitioner? He's like, well, it's similar to a doctor. You get to prescribe drugs, medications. You see your own patients. You can even open your own practices in many states. And you basically work independently, just like a doctor does. You have your own patients. You do everything. You can work in specialties. It's just a shorter path to get there. And I said, that sounds too good to be true. But he explained to me what it is. And I said, okay. But I was like, man, I just can't get over the blood and all that stuff. So he was a car guy, right? And he kind of just broke it down to an analogy. And I hope this sticks with somebody else listening or watching today as well. And he said, think of the lungs as the exhaust, right? And think of like the motor as the heart or the engine, right? And the rotors and the tires and the wheels like as your legs and your arms, and then the oil is like the blood. And when he kind of broke that down, like I had that aha moment. I was like, whoa, you know what? I like to help people. I've always liked to help people. I was always into health and fitness, working out and taking supplements and whatnot, right? And vitamins, and I can make good money, right? So I got into it kind of late. I was 27, 28 years old already at this time. And so being an MD was like out of the question, right? I mean, I'd be like just now getting done or something. And I still needed to provide for myself, right? So for me, I had a degree already in business. So I looked at some programs, and I found that you can get a second degree, accelerated BSN, which is a bachelor's in science and nursing. And what I found is that it was like I think it was like a 2-year degree, basically a 2-year or 1.5 years. It was accelerated. So you're constantly, going to class and clinicals. So I was able to get the prerequisites, and that took about like a year. Like that's your anatomy and physiology 1 and 2, biology, chemistry, all your basics for nursing. And I was very blessed to have amazing professors in anatomy and physiology 1 and 2, and they saw something in me, and they really took me under their wing, and they said, hey, you can be great because you have so much passion for this and you're catching on really quickly. And so, I took that confidence from these people I really respected, and I took it into nursing school. And I went to University of Texas at Arlington. It was actually like a hybrid program. It was basically your curriculum was online. You learn at your own pace. All your clinicals were at hospitals, of course, and all the exams were done at the university. So you do have to attend in person in real life. So, you can't cheat.
Good to know.
Yeah, absolutely. And then once I got that done, so now the rules are a little different, I believe. I don't believe you need to actually have any RN time working as an RN. I think you don't have to have much time, but at that time you needed 3 years experience as an RN. So I went to Sugarland Methodist, and I worked on the medical surgical floor, where I always knew that I wanted to be a nurse practitioner. The end game was NP, not RN. And what I did is I took that job very seriously. I used to write down all my medications and try to memorize them and see what they were for. I used to follow all the specialists inside and pick their brains. And, I try to pretend like I was a physician. Of course, I wasn't a practicing physician, but I would always take good notes and learn all the tricks of the trade. And, I worked in different departments in the ER. I would float around. I was on a float pool. So I worked in different departments, not just medical surgical. I did neurological or neurology. I did cardiovascular. I did orthopedics. I even worked for inpatient rehab for a while. And I saw every area of medicine. I did post-op, so for people who come out of post-surgery. So I just learned everything I could like a sponge. And I went in after 2 years of working. They allowed me to go ahead and start schooling as an NP. And that was at Texas A&M Corpus Christi. And that was also an online hybrid program. And then you still have to do your clinicals locally. You find a physician, whoever can take you under his wing. And I was very blessed. I found Dr. Rajani. I found many other ones that were awesome as well, but he really stuck out to me the most. And he taught me everything I knew. He gave me a lot of respect and confidence. And yeah, so I graduated, I think it was like 4 or 5 years ago. It all kind of blends together now. And I've been working at Katy Wellness Center, and I also do clinical research where we look at phase 3 pharmaceutical trials. So that's aside from Katy Wellness Center. And yeah, so I kind of did that, and then I went into functional medicine. After that, I worked at I'm in a couple of fellowships with the American Academy of Anti-Aging. I actively listen to 2 or 3 hours of material a day. Yeah, it sounds like a lot, but when you're passionate and you're enjoying it, it's not even enough, right? Because all this stuff is so intriguing. It's cutting edge. It's next level. It's not the stuff you learn in school. In school, what you're going to learn is just to be a safe provider. You really learn everything else in practice, right? And this is the art of clinical practice. This is why you're going to see some doctors do things slightly different than others. It's what they've studied and what they know. So the path was, it has its ups and downs for sure, because you're still working and you're trying to go to school, and it can be difficult. But to be really honest, and I mean this in the most humble way possible, it was the easiest thing I've ever done because I truly loved what I was doing. I had no problem. I loved studying. I loved learning. I loved the tests. I loved writing the posts because I was enthusiastic about it, right? And so if this sounds like you, then, if you're listening out there, and maybe this is your calling, right? Go out there and see what you can make of yourself. The sky's the limit, especially if you truly love this field. Do it, because I'm able to help my mom, my dad, my sister, my cousins, everybody in my life, right? I can look you guys straight in the eye and tell you I've saved countless lives, not only people who are strangers, but loved ones of mine. And you guys know if you're watching out there, who you are. And, that would have been missed. And if I didn't do what I did, you guys wouldn't be here. And that's amazing to me, right? That makes me it kind of tear up a little bit, right? So,
amazing.
yeah.
That's amazing.